Leader, third party.
Thank you, Mr. Speaker. In the last few years, there have been substantial mental health funding commitments made by the provincial and federal governments, including the creation of the BC Ministry of Mental Health and Addictions, as mandated by the Confidence and Supply Agreement. Even still, in Canada, only 7% of the healthcare budget is dedicated to mental and behavioural health. As a result, access to comprehensive mental health care and addiction support often depends on the size of your bank account. Data clearly shows that lack of access to mental health care is most pronounced in those with lower incomes, fewer years of education, minority groups, and people with other vulnerabilities. Based on this year's budget estimates, it appears the breakdown seems to be that over $20 billion is being spent on the Ministry of Health and $10 million for the Ministry of Mental Health. My question through you, Honourable Speaker, is to the Minister of Finance. Does the Minister have a more detailed breakdown of the percentage of the BC healthcare budget that is dedicated to mental and behavioural health care delivery?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker, and we are working very hard to build a comprehensive system of mental health and addictions care in the province, and we certainly believe that we need to get to a place where mental health is treated in the same way that physical health is. We have not had a system that does that, and we have a long way to go, but our government has been making some significant investments. We spend an average, and we canvass this in estimates, an average of $2.5 billion a year on mental health and substance use care. In addition, those are figures from last year. In addition, we have committed $74 million to new initiatives for child and youth mental health, Honourable Speaker, and that includes expanding Foundry to 19 centres we've committed to across the province. There was $3 million budgeted for Foundry when we took office. It will be $15 million this year, Honourable Speaker, 5 times as much. And the member used the term access to care should not depend on the size of your bank account. And he's quoting very well from when I made the announcement, a $10 million announcement last fall of significant investments in mental health and addictions counselling, the most significant investment in a decade, Honourable Speaker. And we believe we needed to build access, strengthen access to counselling on the ground by investing in community agencies, no-cost and low-cost counselling, with those funds targeted specifically to the most vulnerable people in the population. A third of those agencies who received that funding were Indigenous organizations, Honourable Speaker. In addition to some of those things, we're beginning to build child and youth mental health teams in our school districts so that we can start early and catch small problems before they become big ones. In the Ministry of Education, $12 million invested in school-based mental health programs, and the Ministry of Advanced Education, for the first time ever, Honourable Speaker, post-secondary education students have access to 24/7 phone line for access to mental health counselling. We're just getting started, Honourable Speaker. We've got a long way to go. We had a big mess to clean up, but we're on the road, and we've made some significant progress to date. But we absolutely need to get to a place where we reduce the stigma about mental health and addictions, and where we get to a place where we treat it with the equity with physical health that it deserves.
Leader, third party on a supplemental.
Thank you, Mr. Speaker, and thank you to the Minister for her comprehensive response. For most British Columbians, our healthcare system does not guarantee access to specialized, evidence-based mental health care treatment. Consequently, our walk-in clinics and emergency rooms become the de facto provider for people experiencing mental health challenges. This, in turn, leads to individuals overusing the healthcare system because their mental health needs are not being adequately addressed. Ineffectively treating mental illness costs our healthcare system twice as much as providing appropriate care in the first place. As the Minister noted yesterday, 4 out of 5 people killed by an illicit drug poisoning had previously been in contact with the healthcare system, most likely with the primary care system. GPs are working heroically to support people in crisis, but they are inundated and in need of additional specialized mental health resources. Research shows that when patients are provided with brief psychological assessment and targeted cognitive and behavioral interventions, their conditions improve both mentally and physically. My question through you, Honourable Speaker, is again to the Minister of Mental Health and Addictions. Does the Minister agree that by providing a level of mental health accessibility similar to what we expect for physical health, we can better create health outcomes and lower medical costs?
Minister of Mental Health and Addictions.
Thank you, Honourable Speaker, and thank you to the member for the question. I don't think there's any question that that is a goal that we share. It's going to take us a while to get there. And Honourable Speaker, we're very proud in Canada to say that we have a universal healthcare system, but the reality is that at a federal level, mental health and substance use is not integrated into universal Medicare the way that it should be. So we continue to press the federal government for further investments because it is absolutely the case that too often people have to pay privately for access to care. They have to pay for psychologists at the tune of $150, $250 an hour. They have to pay privately for access to addiction care. So we are strengthening the public parts of the system while we continue to press the federal government to treat mental health and substance use truly as part of universal Medicare in this country. But I would also note, Honourable Speaker, that we are integrating mental health and substance use into primary care. We've heard the Minister of Health announce in one community after another new urgent and primary care centres, new mental health, new primary care networks, and we are integrating mental health and substance use professionals into those teams. In Fraser Northwest Division of Family Practice, where I live, the first division of family, the first primary care network that was announced, there's a team of 5 mental health and substance use professionals attached to that team. So we want to reduce the stigma, we want to expand access through the public healthcare system. Do we have a ways to go? Yes, we do, because this is an area that was ignored for 16 years, but we're on the road, Honourable Speaker, much accomplished and more to do.